Face diagnosis, we take up the cautions. Face reading is best done in the morning. It is best to check your face in the morning when your chi and blood status is neither disturbed nor affected by other factors such as mood changes and exercise. In the morning, your complexion is most natural, and therefore it is easy to detect disease through facial inspection. With a good understanding of the changes in your complexion, you will find signs of any ailment that is developing in your body in a timely manner. Do not wear makeup for face reading. Cosmetics conceal the true color of your facial skin, which is not conducive to disease detection. For example, a sallow complexion is a manifestation of a spleen deficiency syndrome, but a ruddy complexion due to facial makeup may lead the doctor to a wrong diagnosis. Wearing lipstick can make a person with pale lips, a sign of yang deficiency, appear normal, or with balanced chi and blood. Therefore, patients are advised against wearing makeup before seeing their doctor. Let the doctor see you in your most natural state for an accurate diagnosis. Do not consume colored foods or drinks before face reading. Before a face reading session, the consumption of certain foods or drugs with color, such as tomatoes, licorice tablets, or black plums, may lead to misdiagnosis because tomato will turn your mouth cavity and lips reddish, while foods such as black plums tend to make the tongue coating black. Coffee, egg yolks, oranges, yellow pills, and oral liquids will make the tongue coating look yellow. All these affect the color of the face and tongue coating and thereby can lead to misdiagnosis. Stay calm and relaxed during face reading. A person's state of mind is also a factor for consideration. When people are angry, sad, or in a state of ecstasy, their complexion will turn a different color than usual. Therefore, maintain peace of mind and body during face reading so your complexion will not be affected by these emotional factors. Seasonal changes affect complexion. Human complexion changes as the seasons change. In spring, the complexion is faintly greenish, slightly red in summer, but pale yellowish in prolonged summer. That is the last 18 days of each season, pale in fall and a bit dark in winter. Before we continue with the discussion, we will have to take note of some definitions for our TCM newbies. No? Stomach fire is a pathological development caused by exuberance of stomach heat turning into fire. Primary symptoms include heartburn and acid reflux, pain in the stomach, abdominal fullness, dry mouth and bad breath, swollen and painful gums, and constipation or loose stool. Stomach fire is also called stomach heat, and it's usually triggered by indulgence in alcohol or excessive intake of pungent, oily foods and poor dietary habits. Cold syndrome, a syndrome characterized by repression of the functional capacity of the human body due to invasion of cold pathogens or hyperactivity of the yin leading to a yang deficiency. The syndromes are manifested as cold and chill. Heat syndrome, a syndrome characterized by warm and heat features. It is the result of hyperactivity in the body due to an attack of heat pathogens, hyperactivity of the yang in the internal organs, or overactive yang due to a yin deficiency. Clinical manifestations are feverish sensation, aversion to heat and preference for cold, constant desire for liquids due to thirst, redness in the face, irritability and anxiety, thick yellow nasal discharge and sputum, scanty yellow urine, dry stool, and red tongue with little saliva. Liver fire. Exuberance of liver fire that exceeds the tolerance of the human body turns to a pathogenic fire. The causes are mostly emotional factors, improper dietary habits, and pathogenic fire transmitted to the liver meridian. The symptoms are manifested as lightheadedness, redness in the face and eyes, a bitter taste in the mouth, irritability or a short temper, constipation, and yellow urine. Wind heat. Pathogens of wind and heat simultaneously attack the human body to cause diseases. Clinical manifestations are high fever, mild chills, coughing, and thirst. Essence is an umbrella term that encompasses all physical substances in the body, including chi, blood, body fluids, and nutrient essence. Pathogenic heat congesting the lung, internal stagnation of pathogenic heat in the lungs, which often invades through the mouth and nose, or wind cold and wind heat invading the interior, thereby transforming the hyperactivity of yang into febrile diseases, blocking the lung. As opposed to superficious syndrome, interior syndrome indicates that the pathological changes have entered deep into the Zhang and Fu organs, qi, blood, and bone marrow, such that the illness is in the internal part of the body and the condition is more severe and lingering. Superficious syndrome, pathological changes that occur in the superficial part of the body and are often regarded as in the early stage of a disease. This is also called exterior syndrome. Sanjiao, or triple burners or energizers. Sanjiao means the three burners. The topmost burner, the upper burner, corresponds to organs in the thorax above the diaphragm, which are concerned with breathing. The middle burner corresponds to organs in the region above the stomach, which are those concerned with digestion. The lower burner corresponds to the organs lower down in the abdomen, those belonging to the urogenital and gynecological systems. Hyperactivity of the liver fire, a heat-related syndrome due to hyperactivity of the liver function. It is most related to emotional factors, diet, and heat pathogens in other Zhang Fu organs affecting the liver meridian. Main clinical symptoms are lightheadedness, redness in the face and eyes, bitter taste in the mouth, and irritability and a short temper. Deficiency of vital qi, resulting in reduced body resistance to diseases and impaired functioning of the physical body, is a definition of deficiency syndrome. Manifestations are pale complexion and pale-colored lips, tiredness and fatigue, general malaise, shortness of breath, palpitations, spontaneous sweats and night sweats, loose stool, and frequent urination. Yang deficiency, the insufficiency of yang leading to the decline of the body's warming function, which brings about a series of clinical symptoms that are mostly developed from long-term qi deficiency. It is also associated with dietary habits, living in a cold residence for a long time, long-term illness of the elderly, and congenital weakness in the physical constitution. Thank you for your attention.
Let's discuss interviewing the excessive dreaming. Excessive dreaming is another common sleep disturbance, which is usually due to a pathogenic factor agitating the ethereal zone. This may be either a pathogenic factor such as fire or phlegm fire, or empty heat deriving from yin deficiency. Excessive dreaming is difficult to define because dreaming is a normal physiological aspect of sleep. From the perspective of Chinese medicine, it can be defined as a level of dreaming, whether pleasant or unpleasant, that makes the sleep restless or wakes the patient. It also includes nightmares, especially when they are recurrent. Other doctors define excessive dreaming as waking up with an unpleasant feeling from dreaming. By implication, from a Chinese perspective, normal dreaming is not remembered in the morning. Excessive dreaming was called Yi Yu, which means wandering at night. Meeting Yu, which means wandering in one's dream, or Ming Sheng, which means moving in one's dream. These terms are a clear reference to the wandering of the ethereal soul at night when we dream too much. With the exception of the heart and gallbladder deficiency, excessive dreaming is usually caused by a full condition, generally of the liver or heart, such as liver fire, heart fire, or phlegm fire in the heart. Full conditions of the stomach also frequently cause excessive dreaming, and especially phlegm fire in the stomach and retention of food. To summarize, the main patterns causing excessive dreaming are liver fire, excessive dreaming, nightmares, restless sleep, headaches, red tongue with redder sides, and dry yellow coating, wiry, rapid pulse. Heart fire, there is excessive dreaming, restless sleep, palpitations, insomnia. There is red tongue with redder teeth, and yellow coating, overflowing, rapid pulse. Excuse. Phlegm fire, harassing the heart. There is excessive dreaming, restless sleep, insomnia, waking from nightmares, palpitation, agitation, sputum in the throat, red tongue with redder tip, and a sticky yellow coating, slippery, overflowing rapid pulse. For the phlegm fire in the stomach, there is excessive agitated dreams, restless sleep, burning epigastric pain, insomnia, red tongue with sticky yellow or dark yellow or even black coating. Stomach wrapped with a rough, sticky yellow coating inside it. Slippery, rapid, and slightly overflowing pulse on the right middle position. Heart yin deficiency with empty heat, dream disturbed sleep, insomnia, red tongue with redder tip, and without coating, floating empty and rapid pulse. Liver yin deficiency with empty heat, dream disturbed sleep, insomnia, blurred vision, dry eyes, red tongue without coating, floating empty and slightly rapid pulse. Heart and kidney yin deficiency with empty heat, dream disturbed sleep, palpitation, dizziness, tinnitus, red tongue with redder tip without coating, midline heart crack, floating empty and rapid pulse, or deep weak on both rear positions and relatively overflowing on both front positions. Heart and gallbladder deficiency, excessive dreaming, waking easily from dreaming, absent-minded, emotionally unstable, anxiety, and palpitations. Summary for the excessive dreaming: liver fire, heart fire, phlegm fire harassing the heart, phlegm fire in the stomach, heart yin deficiency with empty heat, liver yin deficiency with empty heat, heart and kidney yin deficiency with empty heat, heart and gallbladder deficiency. Thank you for your attention.
Let's go to 5-phase or whooshing theory. Topic is therapeutics number 2. Treatment using the transport shoe points follows the mother-son law. The point associated with the mother of the affected viscous or bowel is tonified in cases of deficiency, or the point associated with the son is drained in case of excess. So let's look at the mother-son points of the 12 regular channels. So if the channel is liver, the mother point is liver 8. That's for the tonification. And for dispersion, which is the sun point, it's the liver 2, which is the fire. For the channel heart or fire, the mother point is heart 9, and the sun point is heart 7. For the pericardium, the mother point is pericardium 9, and the sun point is pericardium 7. For spleen, the mother point is spleen 2, and the sun point is spleen 5. With the lung channel, the mother point is lung 9, and the sun point is lung 5. For kidney, the mother point is kidney 7, and the sun point is kidney 1. For the channel gallbladder, the mother point is gallbladder 43, and the sun point is gallbladder 38. For the small intestine, the mother point is small intestine 3, and the sun point is small intestine 8. For Sanjiao, the mother point is Sanjiao 3, the sun point is Sanjiao 10. For the stomach, it's stomach 41, and the sun point is stomach 45. For the large intestine, the mother point is LI 11, and the sun point is large intestine 2. For the urinary bladder, the mother point is urinary bladder 67, and the sun point is urinary bladder 65. Sometimes the corresponding point on the mother channel or sun channel is also used. So let's look at the mother-sun point combinations for deficiency and excess conditions of the yin channels. So if for the lung channel, if it's a deficiency condition, the affected channel, the lung point for the mother lung point is lung 9, which is the earth of the metal channel. And for the mother sun channel, it's spleen 3, which is the earth of the earth channel. When the condition is excess, the point is lung 5, which is the water of the metal channel. And for the mother sun channel, we use kidney 10, which is the water of the water channel. For the channel of the heart or fire, if the condition is deficient, the point is heart 9, which is the wood of the fire channel. And The mother sun channel is liver 1, which is wood of the wood channel. If it is excess, we go to heart 7, which is the earth of the fire channel, and spleen 3, which is the earth of the earth channel. For pericardium deficiency, we use pericardium 9, which is the wood of the fire channel, and the liver 1, which is wood of the wood channel. If it is excess, we go to pericardium 7, which is earth of the fire channel, and spleen 3, which is earth of the earth channel. And let's go to spleen. So if it is deficient, we go to spleen 2, which is the fire of the earth channel, and heart 8 for fire of the fire channel. If it's excess, we go to spleen 5, which is metal of the earth channel, and lung 8, which is metal of the metal channel. For the kidney, if it is deficient, we go to kidney 7, which is metal of the water channel, and lung 8, which is metal of the metal channel. If it is excess, we go to kidney 1, which is wood of the water channel, and liver 1, also wood of the wood channel. For the liver, if it is deficient, we go to liver 8, which is water of the wood channel, and kidney 10, which is water of the water channel. For excess condition, we go to liver 2, which is fire of the wood channel, and heart 8, which is fire of the fire channel. Thank you so much for your attention.
Let's now proceed to differential diagnosis in Western and Chinese medicine, and let's discuss abdominal pain. Let's start with Western differentiation of abdominal pain. First, we have the gastrointestinal problems. There's in chronic appendicitis, it will manifest with recurrent abdominal pain with fever, loss of appetite, nausea, vomiting, constipation, diarrhea, chills, and shaking. If it is peptic ulcer, it will manifest with abdominal pain, typically relieved by eating. There will be heartburn, belching, chest pain, and blood in the stools. In gastroenteritis, there is upper abdominal pain, indigestion, loss of appetite, nausea, vomiting blood, or coffee ground vomit, and dark stools. In irritable bowel syndrome, there is abdominal pain with constipation or diarrhea, or alternating constipation and diarrhea, abdominal fullness, bloating, feeling of incomplete emptying of the rectum, and loss of appetite. Other causes include inflammatory bowel disease, reflux, esophagitis, lactose intolerance, food allergies, diverticulitis, fecal impaction, and carcinoma. Let's go to hepatobiliary problems. We have chronic hepatitis. There will be abdominal pain or distension, dark urine, pale stools, fatigue, itching, jaundice, weight loss. In chronic pancreatitis, there will be recurrent or chronic upper abdominal pain, mild jaundice, fatty stool, and weight loss. In chronic cholecystitis, there will be chronic indigestion, vague abdominal pain, nausea, belching, and other causes will include cirrhosis and carcinoma. Next, we have genitourinary problems. There will be dysmenorrhea with crampy lower abdominal pain during periods, lower back pain, and endometriosis. There will be dysmenorrhea, pelvic or low back pain, painful sexual intercourse, premenstrual spotting, painful bowel movements. Other causes include ovarian cysts, fibroids, pelvic inflammatory diseases. And other causes will include alcohol, drugs, myofascial tear in the abdominal wall, inguinal or femoral hernia, and vertebral lesion, and depression and stress. Now let's go to diagnostic questioning according to organ interrelationship. So stomach and large intestine, or the yang ming, and liver and kidney in the Shang cycle, stomach and gallbladder in the Ku cycle. So let's next look at its location. It's in the hypochondrium, epigastrium, upper or lower abdomen, and below the heart. The nature of pain will be acute and excess. If it's chronic or recurrent, or excess and deficient, could be stabbing or fixed in blood stasis, could be vague and unlocalized if there is chi stagnation, severe cramping if it's cold, dull nagging if it's due to chi deficiency. It's worse with pressure if it's excess, worse for eating if it's excess, better with pressure if it's deficiency, better with heat if it's cold, better with rest if it's deficiency, better with activity if it's chi stagnation, periodic, accompanied thirst if it's heat, and violence accompanied by fullness if it's excess. Digestive or gynecological, it will be according to external cold, internal invasion of external heat, internal heat, damp heat, repressed emotion like frustration, anger, resentment. It could be due to blood stasis that is following abdominal trauma or surgery, or it could be due to dietary factors like eating spoiled food, excess cold, raw food, or overeating. So for the associations of these problems, it could be related to menstrual cycle and gynecological cases, or eating and defecating in gastrointestinal cases. So for the Zangfu organ pattern in excess, we can find cold invading the large intestine. It could be cold invading the stomach. It could be due to food stagnation in the stomach, damp heat in the large intestine, stagnation of liver chi, blood stasis in the stomach, liver blood stasis, damp heat in the gallbladder, or damp heat in the bladder. In deficiency, it could be spleen and kidney chi and yang deficiency, or stomach yin deficiency. Thank you for your attention.
Let's talk about the liver function of conducting and facilitating. This phrase points to the liver's ability to facilitate movement of qi throughout the body so that it can carry out its action smoothly. This particular function has a vast scope. In a narrow sense, it affects the suppleness or hardness of the liver and the level and ease of its activities. In its broader sense, it affects all the actions of qi and the very complex metabolism throughout the body. These effects are manifested in the following aspects. Number one, controlling the emotional states. The emotional states of the human being are normal responses of the brain to stimuli from the external world. CM believes that the emotional states develop on the foundation of the physiological functions of the Zang viscera. If the liver's conducting and facilitating function is normal, then qi will act smoothly. The mental outlook will be optimistic, the mind at ease and open, qi and blood harmonious, and the Zang viscera in equilibrium. Conversely, if the liver's conducting and facilitating function is abnormal, qi is impeded and leads to abnormalities of the mental state. This is manifested in one of two ways. If the liver's conducting and facilitating function is impaired, then qi cannot act smoothly. Emotional depression, unhappiness, moodiness, insecurity with excessive worrying, and much sighing may ensue. This is known as stagnation of liver qi. If the conducting and facilitating function is excessive, then manic excitement, pressure pain in the head, flushed face and eyes, irascibility, insomnia with much dreaming may ensue. This is known as irrepressible liver fire, or yang. Number two, aiding digestion and absorption. The spleen and stomach are the main digestive and assimilative organs, but the conducting and facilitating function of the liver gives them assistance. This function is expressed in two main aspects. First, the liver smooths the way for qi's functional activity in maintaining the normal functions of the spleen and the stomach to raise the clear and lower the turbid. Second, it promotes the secretion of bile to help with digestion and assimilation of food. Therefore, disturbance in this liver function will affect the raising and lowering function of the spleen and bile secretion by the gallbladder. If liver qi attacks the spleen, spleen qi cannot raise the clear. This may lead to abdominal distension and diarrhea with loose feces. If liver qi attacks the stomach, stomach qi cannot descend. This may lead to stomach pain, nausea, vomiting, and much belching. If the liver loses its conducting and facilitating function, causing the gallbladder to stop secreting bile, then flank pain, bitter taste in the mouth, reduced appetite, and even jaundice may appear. So here we see a very simple illustration of how the liver works in TCM. 3, promoting the circulation of qi and blood. This function of the liver directly affects the normal movement of qi. As qi moves normally, so will blood. Loss of this liver function can impede qi and cause blood stasis, giving rise to distension and pain in the chest, flank, and breasts, cutaneous swellings, and disturbance of the menses. If this liver function is excessive, liver qi rises abnormally and can cause headache, pain, and pressure in the eyes, flushed face and red eyes, hematemesis, and epistaxis. 4, assisting water metabolism. The entire process of water metabolism, from absorption to distribution to excretion, is carried out by the coordinated actions of the spleen, lung, kidney, and the sanjiao. The liver affects it in 2 important ways. The conducting and facilitating function helps to promote water metabolism. At the same time, it helps the sanjiao in smoothing the pathways for qi and for water. Loss of this liver function can lead to impeded qi movement and abnormal water metabolism, and in turn lead to accumulation of phlegm or water and edema. 5, regulating the Chung and Ren meridians. The Chung and Ren meridians are connected with the liver meridian of foot Yin and are subordinate to the liver. Therefore, normality of the conducting and facilitating function of the liver ensures the regulation of their physiological functions by making the Chung meridian ample and the Chung meridian unobstructed. Women then have normal menstruation and men normal ejaculation of semen. But if these functions of the liver and the 2 meridians are abnormal, women may have reduced or absent menses or painful menstruation and infertility, while men may have reduced semen or difficulty with ejaculation. The liver's physiological functions are enabled by the combined actions of liver qi, liver blood, liver yin, liver yang. Liver qi ensures the free movement of qi, which stimulates blood circulation. Liver blood nourishes the liver itself and the connected organs and tissues and restrains liver yang, preventing its excessive activity. Liver yin, like liver blood, nourishes and restrains, and these 2 cannot be separated. Liver yang warms and stands in opposition to and mutual dependence with liver yin. Their interaction in turn preserves their dynamic balance. Thank you so much for listening.
Let's discuss diagnosis according to Sangfung organ patterns. The Phlegm-Heat agitating the heart. This pattern is similar to some ways to the previous one. The difference is that in this pattern, heat also agitates the shen. The heat can have arisen due to the phlegm stagnation itself, or the heat may have been one of the factors contributing to phlegm being created. The etiology of Phlegm-Heat agitating the heart is very similar to the etiology of phlegm obstructing shen. Diet will play a significant role, especially the consumption of food and beverages that have a hot dynamic, as well as those that directly generate dampness and phlegm. Emotional imbalances can create a stagnation of qi in the liver and the heart. Heat can simultaneously agitate the shen and lead to the creation of phlegm. Phlegm stagnation can in itself lead to the generation of heat. Spleen qi deficiency or yang deficiency can also have contributed to the formation of phlegm. This means that the etiological factors that can lead to these conditions may also be involved in the evolution of this pattern. For the symptoms and signs, there is mental unrest and unease, mania, depression or mood swings, aggression, both verbal and physical, spontaneous and ill-considered actions, rapid body movements, difficulty sitting still and being settled. Talking a lot and talking quickly, loud voice or shouting, incoherent speech, talking nonsense or having difficulty maintaining the structure of a conversation. The voice may sound slurred, uncontrolled laughing or crying, laughing while talking, talking to themselves, inability to maintain eye contact, mental confusion. The person may lack a sense of reality. There's peculiar attire or hair, palpitations, tightness, oppression, or unrest in the chest, thirst, bitter or metallic taste in the mouth, insomnia, dream, disturbed sleep, possibly with nightmares. Rattling sound in throat, rapid breathing, dark urine, red tongue with red swollen tip, greasy yellowish coating. There can be a crack in the tip of the tongue. Full, rapid, and wiry or full, rapid, and slippery pulse. Key symptoms, there is mania, talking quickly, mental restlessness, red tongue with yellow greasy coating, and a full pulse. For the treatment principle, drain phlegm heat, calm the shen, and open the heart. For the acupuncture points, choose from pericardium 5, pericardium 7, pericardium 8, heart 8, heart 9, stomach 8, GB 13, stomach 40, do 20, do 24, REN 15, UB 15. Needling technique is draining. Stomach 8, GB 13, do 20, and do 24, drain phlegm from the head and calm the shen. Pericardium 5, stomach 40, transforms phlegm and calm the shen. Pericardium 7, pericardium 8, heart 8, REN 15, UB 15, drain heat from the heart and calm the shen. Relevant advice, the patient should avoid consuming anything that creates heat, such as chili, pepper, garlic, dark chocolate, alcohol, too much red meat, especially the lamb, fried foods such as crisps, chips, falafel, and so on. They should also avoid phlegm and damp-producing foods such as sweets, sugar, wheat, dairy products, bananas, avocados, dried fruits, and so on. It is important that the shen is not agitated further by stimulants such as coffee. Phlegm-Heat agitating the heart can be caused by phlegm patterns, fire patterns, heart qi stagnation, liver qi stagnation, spleen qi deficiency. Phlegm-Heat agitating the heart can result from heart blood stagnation, spleen qi deficiency, yin deficiency, blood stagnation, qi deficiency. For the summary, Phlegm-Heat harassing the heart, etiology, excessive consumption of phlegm-forming foods, severe emotional problems, invasion of exterior heat. Underlying or accompanying pathology, spleen qi deficiency, dampness and phlegm, heart qi deficiency, heart blood deficiency. Signs and symptoms, there is mental restlessness, bitter taste, palpitation, thirst, red face, tightness in the chest, dark urine, expectoration of phlegm, rattling in throat, insomnia, vivid dreams, agitation and confusion, incoherent speech, rash behavior, uncontrollable laughter or crying, depression, manic behavior. For the pulse, there is full, rapid, and slippery. For the tongue, red body with deep midline crack to the tip. Yellow sticky coating, tip may be redder and swollen. For the treatment principle, drain heart fire and calm the shen. Transform phlegm and open the heart orifices. For the acupuncture treatment, we use PC5, resolves phlegm from the heart. Heart 8 clears heart fire. Pericardium 7, pacifies Shen, clears heart fire. Bladder 15, clears heart fire. Stomach 40, resolves phlegm. Liver 2, subdues fire. GP 15, pacifies Shen. Heart 7, clears heat, calms the Shen. Heart 9, clears heart, opens orifices. Ren 15, pacifies the Shen. Ren 12, supplements spleen chi. Spleen 6, resolves phlegm, calms the Shen. And Do 20, restores consciousness. We needle with draining. Thank you for your attention.
Let's go to etiology in Chinese medicine. The topic is external causes of illness. The external causes of illness are factors that originate from the natural world and that invade the body mainly by means of the exterior of the body, the mouth, and the nose. The external causes include the climatic pathogenic evils and the pestilential pathogenic evils. So let's look at the climatic pathogenic evils. There are 6 climatic pathogenic evils. They are wind, cold, heat, dampness, dryness, and fire. Under normal conditions, they are known as the 6 chi and are 6 different kinds of climatic conditions of the environment. These 6 chi are necessary for all things to grow and as such are quite harmless to the human body. However, when the weather changes in abnormal ways and when the body's genuine chi or the primordial chi is insufficient, with reduction in the body's ability to resist disease, then these 6 chi can turn into the 6 evils. Weather changes may be abnormal when they are excessive or deficient, or they may occur out of season, such as exceptionally cold spring or hot autumn, or they may be very abrupt, such as sudden heat wave or a sudden cold spell. The characteristics of these 6 climatic pathogenic evils can be described as follows. Number 1, the exogenous contraction. In general, when the 6 pathogenic evils cause disease, they do so by attacking the exterior of the body, or by invading through the mouth or nose. For this reason, they are also known as the 6 external evils. Number 2 is season dependence. The illnesses caused by these climatic pathogenic evils are correlated with the seasons. For example, wind illness are particularly common in spring, heat illness in summer, dampness illness in midsummer, and dryness illness in late autumn, and cold illnesses in winter. Local independence. The propensity of the 6 pathogenic evils to cause illness is intimately related to the locale and environment of the person. For example, cold or dryness illnesses are common in the northwestern highlands. Dampness or heat illnesses are common along the southeastern seaboard. People who live in damp areas frequently contract dampness illnesses. People who work in very warm areas frequently contract dryness, heat, or fire illnesses. Note that this discussion is specific to China, though applicable to other regions that are on the eastern seaboard of continents in the northern temperate zone. Each of the 6 pathogenic evils can assail individually, but in most situations, 2 or 3 attack the body concurrently. For example, the common cold is due to wind and cold. Diarrhea is often due to dampness and heat, and rheumatism is often due to wind, cold, and dampness. Number 5 is changeability. During the course of pathogenic caused by these evils, not only can the evils affect one another, but they can also, under certain conditions, transform into one another. For example, when the cold evil enters the interior of the body, it can transform into heat, and prolonged dampness heat can transform into dryness and injury yin. In modern clinical practice, external pathogenic evils encompass not only climatic factors, but also biological, like bacteria and viruses, physical and chemical factors. Thus, using the 6 evils to capture all exogenous pathogenic evils and to study the course and progression of diseases through the interaction of causes and responses may not be very detailed, but it is a relatively correct approach. Thank you so much for your attention.
Let's now proceed to the 4th part of the overview on our topic, the emotions. Here is a flow diagram of the effect of the internal organs' disharmony on emotional state according to Chapter 8 of the Spiritual Axis. The liver, which governs blood, and with whom its spirit. If empty, there will be fear, and if full, there will be anger. The heart, which governs the blood vessels, with Shen as its spirit. In empty, there will be sadness, and if full, there will be laughter. The spleen, which governs nourishment, with E as its spirit. In empty, there will be weak limbs and the five zang disorder. If full, there will be distension and menstrual urinary disorder. The lungs, which governs qi with po as its spirit. If empty, there will be nasal obstruction, and if full, there will be breathlessness. The kidneys, which govern essence with G as its spirit. If empty, there will be collapse, and if full, there will be distension and five zang disorders. An interesting aspect of the above passage from the spiritual axis are the sentences, heaven bestows as virtue or da, earth bestows as chi. When virtue flows and chi pulsates, there is life. These two sentences show very clearly the Confucian influence on Chinese medicine. The idea that heaven bestows virtue, the term used for virtue, da, is a typical Confucian term indicating the qualities of the Confucian sage, and the translation as virtue is inevitably inadequate. This is discussed more fully below. Chapter 5 of the simple question says, anger injures the liver, sadness counteracts anger, joy injures the heart, fear counteracts joy, pensiveness injures the spleen, anger counteracts pensiveness, worry injures the lungs, joy counteracts worry, fear injures the kidney, and pensiveness counteracts fear. Here is a flow diagram of the emotions counteracting each other along the controlling sequence of the five elements. So, pensiveness counteracts anger, anger counteracts sadness, and sadness counteracts joy, and joy counteracts fear. However, the above five emotions are not by any means the only emotions discussed in the Yellow Emperor's Classic. In the other passages, worry and shock are added, giving seven emotions as follows. Anger affects the liver, joy affects the heart, worry affects the lung and spleen, pensiveness affects the spleen, sadness affects the lungs and the heart, fear affects the kidneys, shock affects the kidneys and the heart. Zhang Jiabin actually mentioned 8 emotions in his classic of categories. These are excess joy, anger, pensiveness, worry, fright, shock, sadness, and fear. Besides the usual 7 emotions, some Chinese doctors considered other emotions such as grief, love, hatred, and desire. Grief would naturally be akin to sadness. Love here means not normal love, such as that of a mother towards her child or that between two lovers, but rather the condition when love becomes an obsessive or when it is misdirected, as when a person loves someone who persistently hurts them. Hatred is a common negative emotion that would be akin to anger. Desire means excessive craving. The inclusion of this as a cause of disease reflects in the Taoist, Confucian, and Buddhist influence on the Chinese medicine, as all 3 major Chinese religions or philosophies considered excessive desire to be the root of many emotional problems. Indeed, according to Buddhist thought, desire is the ultimate cause of disease. Clinging to external objects or other people and to life itself. Indeed, from a Buddhist perspective, it is the very craving for the warmth of a womb by a soul in the bardo state, or the state in between death and life, that brings our existence into being. This excessive craving, which is one aspect of the emotion of joy in Chinese medicine, causes the minister fire to blaze upward and harass the mind. Finally, 2 emotions that are common in Western patients but not mentioned in Chinese books are guilt and shame. Thus, the list of emotions could be expanded as follows, and these are the emotions that will be discussed here. First, there is anger, which includes frustration and resentment and affects the liver. Joy affects the heart. Worry affects the lungs and spleen. Pensiveness affects the spleen. Sadness and grief affects the lungs and the heart. Fear affects the kidneys. Shock affects the kidneys and the heart. Love affects the heart. Cravings affects the heart. Guilt affects the kidneys and the heart. And shame affects the heart and the spleen. Thank you for your attention.